Adults dealing with cancer diagnoses face some unique challenges. I recently talked with Dr. Ackerman about the challenges that those kids are facing and that there is help available for those kids. Take a listen. A cancer diagnosis is a very scary thing, no doubt. But what if you are a young adult just getting started with your life? Well, unfortunately, young adults account for 4% of all cancer diagnoses. Dr. Ackerman is one of the First Coast's leading oncologists. He joins us every Friday to talk about important health news, such as this one. He's going to talk about cancer in young adults. You've also brought somebody along with you today. Who would you bring?
So I brought a very good friend of mine. Her name is Jennifer Maggiore. Jennifer is an oncology certified social worker. So that means she's a social worker first, but because cancer patients have special and unique needs, there is a subset of social work called oncology social work. In fact, there's an organization called the Society of Oncology Social Workers, and Jennifer, I'm proud to say, is the president of the Florida division of the Florida chapter of the Society of Oncology Social Workers.
Well, Jennifer, we'll get more from you in just a second, but first, Dr. Ackerman, let's start with you. And what are some of the common cancers that you see among young adults today?
So, as you mentioned earlier, 4% of cancers are in young adults. So the vast majority of the cancers we see are in older Americans, older people in their 50s and 60s. 50s for me isn't so old anymore.
Right,
but people,
it's all relative.
Right, but people in their 50s, 60s, and 70s. So as we get older, the incidence of cancer goes up for sort of reasons which we'll get to in a little bit. But in younger adults, meaning adults in their 20s and 30s and maybe early 40s, they get cancers as well. Not too many, but they get cancers that are a little bit different and more unique than the older adults. They get cancers of the reproductive system, testicular cancer, ovarian cancer. They get certain skin cancers that we call melanoma. They get leukemias and lymphomas, which we don't see as often in older Americans. And also women get breast cancer, believe it or not, at a young age. There's a significant number of women who are in their 30s, early 40s with breast cancer as well.
So why are we seeing this? Why are we seeing more women getting breast cancer at a younger age? Is this a newer phenomenon, or is this has always been happening and we're just putting more attention on it now?
Well, the incidence of breast cancer in America is going up. And it is going up in younger women as it is in older women. Luckily, breast cancer is being diagnosed at a more early stage than it was in the past, so our survival of breast cancer is higher than ever. But the overall incidence of breast cancer is going up for a couple of reasons. One, we have better ways to detect it, so we're seeing it a few years earlier maybe than we would have in the past, or a few months earlier, and you look at populations, we're diagnosing it more early. And also the certain lifestyle impact on breast cancer, meaning that we see breast cancer more often in women who have their first child at an older age. So more women in America now are putting off childhood till they're older, they're going through college, they're becoming professionals. So we're seeing a higher incidence of breast cancer in younger women.
Yeah, well, Jennifer, let's bring you into the conversation now. And let's talk a little bit about what you see with your expertise as far as what these kids or actually young adults, I should say, what they face, what challenges are they facing?
Right. Well, this is a really unexpected time to be diagnosed with a life-threatening illness. I mean, you can imagine. It's
terrible. Yeah.
You're starting a career, you're raising families, so this can really put a huge impact into their goals and what they're trying to do in their life at that time. So they may be worried about their survival rates, how to talk to their family, workplace discrimination. They may have more aggressive treatment, so their side effects may be more to handle for them. But one of the biggest concerns, one of the biggest stressors they have is the financial impact that this cancer may have for them. They may have a loss of income, so they're not able to work, unlike somebody who's older with Medicare that's retired. They're not relying on an income such as that. So what happens many times is they're underinsured, they have mortgage payments, they have student loans. The stress of that financial part can really impact how they're coping with their cancer.
Oh, sure. The stress is no doubt going to make it much harder physically and emotionally. And so are there any organizations out there to help these kids if they, or I keep saying kids, young adults, but I mean, again, I mean, they were 30, that's really young.
Right. There's some great resources. It's very important to seek resources and support because think about it. There's not many other people in their peer support system that have a life-threatening illness. So oftentimes they feel very isolated. They have a higher incidence of depression. They don't want to go to a support group where there will be people twice their age. So we do have some fun, great resources that are local, such as Live for Today, where they do social outings. They go skydiving. They go to the beach, things that young people would want to do, where they can also connect to other people, where they can talk about some of those concerns that they may have. People their same age, people with the same type of diagnosis. We also have programs to help children cope with a parent's illness, and some great financial resources to help them through that difficult time.
So there are outlets. You just have to know where to start
Yeah, so
looking.
you need to seek an oncology social worker or a healthcare professional that can help navigate them. And the great thing is many of them are on the internet, and this population tends to seek support through computers, through internet, things like that.
Okay, and Dr. Ackerman, I'm sure that there are young adults out there watching and they're thinking to themselves, okay, what can I be doing to prevent this? Is there anything that I can do to prevent cancer, you know, as I get older and prevent even going into this sort of situation?
Well, it's hard. The cancers that young adults get usually are not the ones that are preventable. All the cancers older adults get are ones that are associated with exposure, environmental exposure, lifestyle things such as tobacco use for many, many years. So these younger adult cancers like breast cancer or testicular cancer, ovarian cancer, are very hard to prevent. So what I recommend to people is that you know your body. You do self-examination. You do self-examination of your breasts. You do testicular self-examination. If anything a little funny or awry, see your physician. Look at moles on your body, because melanoma we see in young adults as well. So see if there's any changes in the shape of these moles. And lead a healthy lifestyle. We know that obesity and high cholesterol is related to higher incidence of breast cancer, tobacco, of course, with lung cancer. So lead a healthy lifestyle and minimize your risk of cancer in general.
All right. Well, thank you both. And thank you, Jennifer, for joining us today. And Dr. Ackerman, as always, we appreciate you coming on and giving us your expertise. And if you have any questions for Dr. Ackerman regarding this topic or any other health questions that you might have, you can visit Dr. Ackerman's Facebook page, which is facebook.com/First Coast Oncology.